Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, For Wives Only Seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening and welcome to the amazing Power of Woman broadcast. It's another Thursday evening and we are glad to be here once again for another edition of the amazing Power of Woman. And today is the last Thursday of the month of September already. And so it is the day the last Thursday is when we have what we call Ask Your Gynae, a session that is with our resident gynecologist, Dr. Gugu Gamedze. And it's one of those sessions again. You know, at the conference, it was just so powerful. Last month, it was at the conference where she was talking about you and your female body. And there's another. So if you didn't get to watch that, it's available on our YouTube, on our Facebook. You can go there at the Amazing Power of Woman, and you can go there to just watch. That was a powerful session, just teaching you about yourself and your body as a female. You know, this whole program, the Amazing Power of Woman broadcast, came about because of the book that Pastor Chooks wrote, Dr. Chooks Ogoye, and it's the Amazing Power of Woman book. And you know, that book, out of it, so many things have come out of that book, that revelation, that knowledge about the power that God has given woman. And you know, we speak into the three dimensions of a woman: her spirit, her soul, and her body. So once a month, we have what we call Ask Your Gynae, which deals with her body, you know, aspects of a woman's body, just knowing about her body, the complexities of it, and just knowing how to take good care of it and to understand the signs that we see concerning the things happening in our body. So today, Dr. Gamedze will be teaching us on hormonal imbalance. Yeah, that's the topic for today. So I just want you to, you know, key in, and please be sure to share this link with somebody. There's somebody out there who needs this knowledge, who just getting the wisdom that will be shared today will really make a difference for them. They will understand what they are going through and know how best, you know, to go about dealing with the issues that they face. That's the whole essence of this broadcast, to bring wisdom, to bring knowledge, to bring understanding, to help us be able to, you know, understand what is happening in our body so that we can take appropriate action, whether you're praying about it, whether you're seeking medical help, but at least you know what it's about. You understand, you know, the psychology of your body and how it works and how it operates, what is happening with your hormones and all of that. So today, I just want you to, you know, relax as she comes on and is teaching on, and she will be explaining on hormonal imbalance. Thank you. Have a beautiful one today.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Woman broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
A very good evening to our lovely listeners. And again, thank you so much to my pastors, Pastor Chooks, Pastor Twain, for yet another lovely, beautiful opportunity to sit and dissect wonderful topics as women. And thank you to you for taking time to sit down, join us in this special topic of Ask Your Gynae. Today, we're just discussing a very interesting topic, or rather a very buzzing topic around hormones. So we are going to discuss hormonal imbalance. Oh, wow. I can already hear the interest about it. Hormonal imbalance is something that everybody is talking about, from a basic point to a very extensive point of understanding what it is, how it impacts one's life. So for the purposes of this discussion, just to trigger your interest, just to trigger your health-seeking behavior, and also the researching a doctor inside you, we are going to discuss what are the hormones, what do they do in our bodies, how do they work, and how do they impact our day-to-day life? And if there is an imbalance, what is it that we should look out for? Or what are the symptoms? How are we going to feel if there is any hormonal imbalance in our lives? Okay, let's go back and check. What are hormones? Everybody talks about hormones. When they've got certain looks, yeah, it's because my hormones. When they feel a certain way, it's because of my hormones. So what are hormones? Hormones are specific chemicals that work or circulate in our bodies. They are very effective in small amounts. And usually they've got a trigger, they've got a place where they are manufactured, they've got a place where they are released, they've got a target place, and then they effect a certain function. So it sounds like a long tract, but it's a tract that starts from the brain, goes to the target organ, and then the target organ will enable the body to do a certain function based on that specific function of the hormone. What I want us to note is that we've got basic hormones, which are somatic. They work in our bodies on the day-to-day functioning. And then we've got what we call sex hormones, which are responsible now or responsible in a gender-sensitive manner. So as a gynae, I'm going to focus on the ones that affect our sexual functioning or our gender designation or the function that is related to us as women. Okay, so each and every one of us has a place in the brain. Hey, I'm going to tell you science today, but even if you don't understand the nitty-gritties of the science, I will tell you what is it that I want you to take from that. So in the brain, we've got a place that is called the hypothalamus. It is very much responsible for the triggering and the prompting of a small place called the pituitary. The pituitary is a small, the size of a nut that releases the hormones. It's got 2 poles. There's a pole in the front and there's a pole at the back. Most of us women use both poles. We use both the front pole and we use the back pole. The back part of it, which is the posterior, is the one that's loaded. The anterior has got fewer, but it is also useful in our day-to-day functioning. Okay, then the hormones now have this major trigger starting from the pituitary, and it travels in channels, very specific channels. We call them neurotransmitters. They go straight to the part of our body where they work. So in case of the woman, we've got number 1, the breast, number 2, the thyroid, Number 3, we've got the ovary. So ovary is what we speak about very, very often, which is the basket that carries our eggs. That influences a lot of things. So that basket has got 2 major hormones. One, we call it the estrogen. The second one, we call it the progesterone. Those are the major hormones. Not to dispute the fact that as women, we also have testosterone. We don't have the testes, but our testosterone is manufactured peripherally, meaning that now after the estrogen has been formed, then it can be somehow modified to give us testosterone levels. Oh, wow, we have it? Yes, we got it. We got it. Okay, and then the thyroid, the reason why I am bringing it into our discussion, thyroid sits in your throat, behind your throat. It's a gland that sits behind your throat. The reason why I'm mentioning it, it's because it also has a bearing mainly in our mood. So I'm bringing it in, and it takes part also in our weight and our skin appearance. So I'm dragging thyroid to come in. Then with breasts comes the lactation hormone, which is oxytocin. Oxytocin comes from the anterior part of the pituitary. It's one of the few hormones that come from that part. So oxytocin is responsible for the let down of milk, and also during sexual activity, it is also responsible for the processes that go on there. Okay, for the purposes of this discussion, I just want us to say, now, as a woman, if I have got hormonal dysfunction, hormonal imbalance, how do I know? It's a very wide class, very wide spectrum of disorders that can be categorized into weight, mood, fertility, menstrual dysfunction, and also some other somatic signs. By somatic signs, I mean the things that we can see, like, oh no, you're losing your hair, your skin is getting dark, and so on. So let's move step by step. Number 1, the weight. There are a lot of factors in a woman's body that control weight. Some, when they are stressed, they pick up weight. Others, when they are too happy, they pick up weight. But with hormonal imbalance, the weight gain is usually very rapid, or the weight loss is very rapid. So you are not doing anything to gain or lose weight, but in the shortest space of time, you can say you've gained more than 5 kilograms, 10 kilograms. That's a sign that there is hormonal imbalance. Number 2, around mood. Oftentimes now we are being treated for anxiety, depression, and so on. Yet we find out that that is due to a hormonal imbalance. So the commonest one is depression, where you find that your mood is always down, you're sitting and you're crying for nothing, and you feed yourself unnecessarily. That can be a sign of hormonal imbalance. Menstrual, that is also common. With menstruation, you may find that number 1, your period disappears. Number 2, it becomes irregular. Number 3, by irregular, I mean that it pitches up when it wants to, for the duration that it wants to. If it comes at the expected time, but the number of days fluctuates, we will still call that a regular period because it pitches when it is expected. Number 3, you may find that the period is very heavy, heavier than expected. It doesn't stop when it is expected to stop. That is a sign of hormonal imbalance. Then sleep disorders. Some ladies will sleep excessively. Others will have difficulty falling off to sleep. Others have difficulty maintaining sleep. Others have difficulty arising from a sleep. That could be a sign of hormonal dysfunction. Usually, in the female body, you would know when you are very exhausted and you need rest. But if you are beginning to question yourself why you are oversleeping, when you want to wake up, your body is just heavy, you've got this extended, unexplained fatigue, that is a sign that there is hormonal imbalance. Sexual dysfunction, you might have a low libido, you might have a dryness, you might have irritation, being unpleasant to be around. Those could be signs of hormonal imbalance, hormonal dysfunction. Then about hair, most ladies will complain that their hair is thinning out, their hair is falling off, their hair is not growing, there is dryness of the scalp. Those are various ways and various degrees of hormonal dysfunction that the body can display. There are still many more signs that you will find out when you go do your reading or when you get your consultation. But I felt, let me just mention these few which are so common amongst women with hormonal imbalance. In medicine, everything has a cause, everything has a treatment. What would cause hormonal imbalance in a woman? It is multifaceted. Let me just start off with basic things. We like to look at diet. How is your diet? We will look at your work schedule. How is your work? There is something in the human body that is called the circadian rhythm. It is what regulates the alertness and the sleepiness of the body. So your body is timed by the Creator that when there is darkness, after so many hours, it retires. But if there is light throughout, your body may not tap into that knob of now it's time to fall off to sleep. So nowadays we work around the clock. We've got electricity available. We've got our phones that we look into throughout. So our body loses that rhythm. With that rhythm lies the master key of the other hormones. There's hormones that are best secreted when you are asleep. There's hormones that are best secreted when you are not asleep. So the one major thing disrupts the whole cycle or the whole timing. So that's number one. Number two, we find that the type of food that we eat has an impact on the way proteins are made in our bodies. When we were designed, we were not designed to get hormones from outside. Our bodies were designed to eat and then make what they need from the food that we've eaten. But nowadays, there's hormones in our water, there's hormones in our food, there's hormones in our tablets. So it is so difficult now for the body to know, what am I doing at any particular point in time? So that also contributes. Thirdly, medications. We are all taking one medication for that condition, and that condition has got a side effect from its medication, which needs another medication. So we've got a lot of medicines that we are taking, which impact our rhythm, our natural rhythm in the body. The other thing, it's contraceptives. I'm sorry to single them out, but they form part of the hormones that we take. So contraceptives, we use them to fix a lot of things, but their net effect is that they can also affect other hormones if they come in certain quantities. So those things we may not be able to discuss when we are instituting the treatment, but there are some expected side effects from we call them exogenous, or from the outside hormones that we take. So the main clusters that I've mentioned food, I've mentioned work-related stress, I have mentioned medicines. So those are the main things that can trigger hormonal imbalance in our bodies. Women nowadays, they do work that was initially done by men, meaning that the level of stress that we are exposed to is usually extensive. It's I always call that it's heavy for the ovary. The ovary is a fragile structure, but because we are doing the work that was initially done by men, we are exposed to higher level of stress, yet we are still expected to nurture the home. So that finding that balance of work-home life also impacts our bodies in the way they handle the hormonal variations. So now, why should we be concerned about hormonal dysfunction or about hormonal imbalance? The main reason why we should be concerned is because it impacts our day-to-day life, to start off with. And secondly, for me as a gynecologist, it impacts our reproductive life. So you find that when you are ready to start a family, I still need to go back and make your period to be regular. After making your period to be regular, I need to help you now to lose weight because you are a risk when you fall pregnant. After that, you find that actually when you've lost your weight and also when you have your period, the quality of your eggs is also compromised. You now need to have assisted reproduction. So it triggers a cascade of difficulties as a woman to be able to fulfill your reproductive duties. Also, families suffer. The quality of sexual life that we're supposed to be having becomes compromised because our hormones are not in order. So that is why it is important as a woman to identify the factors that can result in hormonal imbalance. As a gynecologist, what would I do to assist you in the treatment or in the management of hormonal imbalance? There's a few things that we have mentioned that contribute towards hormonal imbalance. So the first thing is, I always say, treatment number one is to identify that there is a problem. If you do not see that there is a problem, regardless of what anyone can do for you, you will not be receptive to that kind of intervention. So number one, do agree or do observe that there is a problem. Secondly, you must stretch forth and seek help. So help from a gynecologist is available in that, number one, we can make the diagnosis of hormonal imbalance and we can try and assess at what level. Is it at a brain level? Is it at the target organ level? Or it is at execution level? Let me make an example. If a woman develops a tumor in the brain, it may not present with a headache, it may not present with confusion, it may not present with aggression, but it can present with loss of periods. So if a woman loses her periods, the first thing that we would like to know is at what level is the affectation. So if we find that there is a tumor growing in the brain, we institute treatment and the periods are restored, we have treated that woman. If the imbalance is at the level of the ovary, for an example, when we do an ultrasound, we may find that there's a big ovarian cyst there, and immediately after we treat it, either with an operation or with hormonal treatment, and it disappears, the period is restored. If the problem is with the end organ, you might find that actually the ovary is cool, it's the womb that has a problem. The womb does not respond, or the womb has some growth inside it, triggering that it does not respond well to the hormones that are available. So for me, it is to find out at what level is the affectation. There's a lot that can result in affectation at brain level. Another example that I can cite is a lady who gives birth today and bleeds excessively, say more than half of her body volume of blood. That lady will develop a condition which is a condition called Sheehan syndrome. So what happens is that nut part in the brain that we spoke about loses its blood supply. And once that has happened, you find that the woman now cannot have her periods. So you find that she still has the ovaries. The ovaries have got no signal coming from the brain. So that can be treated or can be managed at a specialist level. So it is important that if you see a certain symptom, you go and you seek help around what can be done. Contraceptives, they feature a lot in our treatment options, but they usually there to regulate. They don't always treat the root cause. So I always say, if you go to your GP because you're not seeing your period or because your periods are excessive, and doctor will put you on a certain contraceptive for about 3 months. If at the end of the 3 months you stop your treatment and the symptoms come back as if nothing was done, then please be so kind and ask for a referral, because it means that you need to be managed at a specialist level. And secondly, in some instances, you find that there just needs to be high-level operations that are done either at the level of the gland, which may be the thyroid, or which may be your ovaries, or which can be the pancreas, depending on the gland that is affected. Then multidisciplinary interventions are organized. Let me make an example. If you've gained so much weight, maybe you're around 160 kilograms, your periods are so irregular, you've got a mustache, you've got acne, your skin is full of acne. For me, that's like a spot diagnosis of hormonal imbalance. So we may find that already you've got glucose intolerance, which points towards early onset of diabetes. We know that diabetes is a sign of a hormonal imbalance. So if you've got now early onset of diabetes, you've got acne. Acne is a sign of high testosterone. The growth of hair, like mustache, you're developing some beard of some sort, it's a sign that there is a hormonal imbalance. When we manage such a patient, that patient will not be managed solely by a gynecologist. We need a physician to come into place to manage the abnormal sugars. We need a dermatologist to come into place to help us manage your skin. And then I will be there to manage how the ovaries are functioning. So hormone imbalance, it's a very wide exposure topic, but for the purposes of this discussion, I wanted us to know that it is something that is there. It is something that is easy to diagnose. It is something that is manageable. And the overall outcome is that every part of your body, or you as a woman in a body, you must be in what you call homeostasis. That is an area or a space of proper balance. Balance that comes from each and every chemical in your body being well positioned for its function, and each part of your body executing its function according to its creation due to a natural response to the chemical substances that are floating in your body. Having said all of that, cure for hormonal imbalance starts with you. Accept that there's a problem. Number 2, let us watch what we eat. Diet forms the biggest part of our nutrition or of our treatment. Food is treatment. We are what we eat. Most of us, like people are always make it a joke when I chat with my other friends that we eat from a debt perspective. That you know what, I never used to afford going to McDonald's and buy myself a meal. So now that I'm working, I'm gonna pass by every evening just to spoil myself with a meal. Remember, you are what you eat. If you're eating from a debt perspective, you're going to disrupt your body's natural defense system, your body's natural metabolism, and your body's homeostasis. So it is very important for all of us to watch what we eat. Some programs will put you on detox and so on. Please do consult a dietitian before you go into such a diet. It is very important because sometimes you find that your kidneys are already showing signs of compromise and you go on to a high protein diet, you're going to stress your kidneys, you're going to stress your liver, you're going to stress your gut. So it is important to consult a dietitian before you go into any diet. And then medication, any medication that you go on, please do declare other medicines that you are taking, because we've got one body. Every time you take medication, there's what we call drug-drug interactions. So if you don't disclose the medications that you're taking, it will impact your overall body functioning. Traditional people, they take traditional medicines. Please do declare. Some of these medicines, we don't know the dosages, we don't know their mode of functioning, we don't know also their origin. So it is important to declare all medicines that you're taking so that your treatment is tailored. Now, lastly, I'm going to emphasize that if you are seeing your gynecologist for hormonal imbalance, make sure that tests are run so that the appropriate people can be invited into your care. Hormonal imbalance, is it a reality or a myth? Yes, it is a reality of our time. We need to make sure that we take care of our bodies to be able to function in homeostasis. In ending, I'm just going to say that we are all stewards of our bodies. This is the best talent that we've been given. That is our bodies. The more we take care of our bodies, the more we're going to be functional. And every woman, to be amazing and to be powerful, you need to be in a good state, the state of homeostasis. Thank you so much for listening to this topic. Please do tune in again on our Ask Your Gynae sessions, which we air on every Thursday of the last Thursday of the month. And also, if you do want to communicate with us, we are on email, askyourgynae@gmail.com. Thank you so much, and God bless you.
Wow, thank you so much, Dr. Gametse. Thank you for bringing such knowledge and wisdom concerning this topic. You know, so many people, you hear so much about hormonal imbalance and all of that. And thank you so much for all those things you've explained to us, how it actually affects, you know, our whole body and just the science of it, and just understanding how these things play out in our bodies. I just want to thank you so much. We really are glad for today's session. Once again, I want to encourage those of us who are watching, please kindly share this with somebody around you. Send the link, whether on Facebook, on YouTube, on the Amazing Power of Woman channels, or also on Pastor Chuks' channels, YouTube and Facebook. Just send this thing to somebody around you. Somebody will get knowledge even from today's session. Thank you so much, and that's it from us for today. God bless you. Enjoy the rest of your evening. Bye-bye.